It's California Edition. My name is Brad Pomerance. We are coming to you from Sacramento, California. We are joined by the Lieutenant Governor. His name is Gavin Newsom. Sir, thanks for joining us.
Good to be here.
Appreciate it.
Thank you.
I want to speak with you about something you've been talking about since you've been in office, and that is whether California operates in a business-friendly manner.
Yeah, not as business-friendly as we should be, but I do think there's a lot of hyperbole around this issue. And I know a thing or two about this. I have 15 small businesses myself. I've created over 1,000 jobs in the state of California, so I don't come at this lightly. I've been on the receiving end of California's largesse in terms of its education system, the infrastructure, research and development, open immigration policy, and regulatory environment, all benefiting from those things. And I've been on the receiving end of some of the things that are a little bit more laborious, sometimes a little bit more costly and frustrating.
Talk about some of those. We know there was a lot of news coming out of Southern California, Torrance, with Toyota making a decision to move its headquarters to Plano, Texas. But if you dig a little deeper into it, it may not have been Torrance or Toyota fleeing California, but there were some reasons. They wanted to be in Texas. Southern manufacturing close by.
Look, the world's changing. In the past, those companies came into California. You've seen a lot of historic context to this, particularly automobile manufacturers came to California because proximity, particularly from Japan, the flights were easy. You had the infrastructure down there in Long Beach and LA ports, so the transportation network existed. But that's a world that no longer exists. We're living in a hyper-connected, not a connected world, and as a consequence, they're moving their distribution centers all across the United States, getting closer to their customers. And so that was at least their argument in this case. That said, look, it's a big blow to the folks down there in Torrance and in LA County. It's a big blow to the reputation of California. Is it at the end of the day, in the aggregate, devastating? Not even within a margin of error. But it's something that we need to be cautious and thoughtful about.
See, what I'm wondering, though, is if we're creating this mythology that California is not the place to be for business, when in reality, there's a lot California has to offer. And Texas, is able to kind of be the bully when, if you really look at Texas, they have some challenges. I mean, they don't have...
No question. But you know what? I got to give Governor Perry credit. And this is not an easy thing from coming from my tribe, right? Democratic Party tribe. But he's in the game. He's aggressive. He's making a case for his state. In my business, part of the job being CEO is getting out there, making a case, being aggressive against the competition, and focusing on your attributes and your assets. At the end of the day, they've done a good job. They've done a much better job in their exports policies. They've been much more aggressive in their trade strategies. They've been very aggressive, not just recruiting businesses, but also focusing on retention. That said, look, with all due respect to Rick Perry, his balance sheet is desperately wanting in contrast to the state of California. There's no balance sheet in America as robust and diverse as the state of California is. We have more researchers, more scientists, more engineers, more venture capital, better universities. So at the end of the day, here's the question. What defines our excellence? Are we going to be the cheapest place to do business, or can we truly be the best place to do business? And if we're going to maintain our status as the best place to do business, not the cheapest place per se, then we've got to focus on those growth engines that I spoke of. We had a formula for success in this state. In many ways, we have to go back and read our own history. We were the tentpole of the American economy in the 50s, 60s, and 70s in job creation. And we started to lose our way in the 80s, 90s, and in the last decade. We have to step up our game unquestionably. And we've got to focus on those areas where we're not as competitive and be honest about that, but also reignite those growth engines of human capital investment in particular.
What, though? Is it that we need to pull back on regulation, look at our taxing structure?
As a business person myself, with close to 1,000 people hired, I never had to deal with CEQA. And everyone seems to focus as if that's the only solution to an economic question or challenge. It's de minimis. As important as it is for certain industries, at the end of the day, CEQA is not the solution or reform to economic growth.
When we come back, I want to talk more about CEQA, talk about Tesla, one of our favorite car manufacturers. For our viewer on HLN, we thank you so much for joining us. For our other viewers, we'll be right back with Lieutenant Governor Gavin Newsom. So, sir, let's talk about Tesla, if I may. I mean, Tesla is quite a story. The car is absolutely magnificent, very popular, and in fact, I learned that 1/3 of all Teslas sold globally, all in California. So it's a California story.
I mean, and their brand is our brand. Their brand is innovation. innovation is the #1 brand emanating out of California. We have entrepreneurialism running through our veins, and they're certainly an example of that. So their success in many respects is defined by our success. We're truly a partner with Tesla, and as you maintain, we've been very generous, again, to the mythology of California. We stepped up in big ways on tax incentives, on training, and we've spent a great deal of taxpayer money on subsidizing the car purchases for people with a lot of money that may have bought it anyway that still got a rebate, including folks like me that are a beneficiary of that rebate as someone that is a Tesla owner. So we've got to we've got to maintain that investment, and we've got to double down to the extent we can in a competitive environment to make a case that California can continue to support that growth and not just limit that growth and see it spread to other states.
Here's the challenge, though. Tesla is looking to bring down the cost of its vehicle, and one way to do that is to improve on its battery pack. And so there's a discussion about where to put the battery manufacturing
Yeah, we're talking
facility.
about 6,500 jobs. We're competing right now with Arizona, New Mexico, Nevada, and Texas. Those are the ones that they've identified publicly. We've been quietly trying to make a case for Tesla that if you want to follow the model of Toyota and move your facilities from California and Torrance to be closer to your manufacturing in Texas, well, why would you ever move from your manufacturing base here in Fremont, Northern California, and move to another state? So we're making that case. We're making the case that we've been aggressive in the past to streamline CEQA to the extent it is an inhibitor in terms of creating some certainty as a process to build a manufacturing plant in the framework and timeline they have in manner. And we also have demonstrated a commitment to support their workforce development and support other tax incentives that are available not just to them but other companies. Again, it's all about this. You read through, California does a lot for business. We just don't promote the heck what we do. It's amazing, these other states, every time you create 2 jobs and they have a parade going down Main Street. Here we have thousands of businesses coming in every year from other states, including Texas. You would never know about it. So we have to acknowledge our weaknesses, but also celebrate success.
But the challenge for Tesla and any company that wants to expand or grow in California, a few that we can't control. You as a lieutenant governor can't control land prices, wages. So that sets, the field is almost unfair. I mean,
but we can control certain things. We can out-educate. We can create conditions. Look, the 21st century definition of leadership is no longer command and control. It's not selling down your vision. It's climate control. It's creating the right conditions where success becomes irresistible. And that's the spirit of California. We have this formula for success, and we need to recognize that, and we need to celebrate that, but we also need to reinvest in that. That's why I'm very concerned about the cuts to higher education. I'm very concerned about the pedagogy of learning in our higher education system, for that matter, the K-12 education system. I'm concerned about the infrastructure in the state, the lack of robust research and development. I'm concerned about our stale immigration debate. I'm concerned about a regulatory environment that needs to be more flexible.
And let's talk about regulation, because if you look at surveys, I think it's fair to say that you can mince words on taxes, but it appears that taxing, we're generally in the middle in terms of business taxation.
Yes.
On regulation, it's very hard to deny that we are a highly regulated state.
Yeah.
And so what can we do? I mean, Governor Brown says he wants to reform regulation. The Democrats...
Flexibility, redundancy, time to decision making. There's so many things you can do without weakening regulations just to be more friendly to those you're regulating. When we do this, when we flip the pyramid. Here's my whole thing. I come from local government. I have a bottom-up mentality, not a top-down. I did an economic development plan for the state called Regions Rising Together. The pyramid needs to be inverted. An economic vision for California needs to be realized at the local level. And it's local government, local regional government that can begin to streamline their operations, link in with the state of California and the federal government. So it's a bottom-up, not top-down strategy. And that's how regulatory reform, from my humble perspective, needs to advance. We get caught up in CEQA debates here. We never get very far. And at the end of the day, it won't even allow us to get far, even if we passed it. There's so many other things from a regulatory framework that are more frustrating to a business owner. The planning department, the ADA regulations where one inspector says it's this and the next inspector comes 2 weeks later and says it's that. The time to decision making, 2-3 months, something sitting on someone's damn desk. The opaque nature of the process. It's not open, it's not transparent, it's not collaborative. There's basic operating principles that we can advance to substantially improve.
His name is Gavin Newsom. He is the Lieutenant Governor for the great state of California. My name is Brad Pomerance, coming to you from Sacramento on California Edition. This is California Edition. I'm Brad Pomerance, coming to you from Sacramento, the state's capital. We are joined by Dr. Ed Hernandez. He's an optometrist. He's also a member of the California State Senate. And sir, I want to speak with you about the Affordable Care Act. Wow, it's hard to deny that the Affordable Care Act lured in a lot of folks. You know, when you look at the signups, over 8 million, way beyond projections. The CBO had brought projections down to 6 million, then maybe 7, way over 8 million. What happened?
Well, what happened is the consumer realized the value, but more importantly, all of what they can get and what's covered. And there's people all over the country, but more in particular in California, were just clamoring to have health insurance. It just shows you the need for health care reform.
And let's talk about California. I think it's fair to say, if you look at the 50 states, the two bright lights, Kentucky, who knows why, and California, in terms of Affordable Care Act signups. Why do you think California was such a beacon in the Affordable Care Act's rollout?
Well, first of all, because we have a committed legislature, a committed governor, but more importantly, the legislature itself wanted to make it its priority. First, to have an exchange. Governor Brown called a special session last year, which I carried all of the special session bills to implement it.
But
California wanted it.
Governor Schwarzenegger, a Republican, had kind of put that into motion.
Yeah, with the exchange.
Right.
Yes.
And so let's talk about, now that we're into the Affordable Care Act, people are receiving their insurance. Are they understanding the process? I mean, to be insured is new for a lot of people. This whole notion of, you know, the culture of coverage. I don't know what to do with my coverage. Are you working with your constituents, for example?
Yeah, I mean, we work collaboratively with everybody in the community, whether it's hospital systems, nonprofits, for-profits, you know, all the groups, to first find out what was going on, what their concerns are. But more importantly, the consumer needs to be educated on how this new product is. So you're right, you have a lot of people who never had health insurance. Well, for the first time, they're going to be able to get vaccines. They're going to get preventative care. They're going to get services they've never been before. They're going to now go see a doctor as opposed to waiting for the emergency room.
And that's part of the key. Is it really is a sea change in terms of receiving and the delivery of medical care. Like you said, the standard course was walk into the emergency room. You got to really change behavior.
Right. Well, most people in the past, if they had insurance, they'd get a high deductible, low out of pocket, would use it very seldom, or people were priced out of the market, would only go to the doctor if they absolutely had to, and most of the times it was when it was either chronic disease that got too out of control and the costs were very expensive. Now what they have to learn how to do is how to utilize the healthcare system in the absolute most efficient way, not wait till the last minute, but more importantly, utilize it when they need it in primary care, preventative care, and get in there and control chronic disease.
I must ask you about the Latino community in California. We had been speaking since October about how low the numbers were in terms of Latino Californians signing up. Boy, what a difference a few months make. By the time the deadline rolled around in late March, Latinos started to enroll in significant numbers, still a bit below population levels, but much better than it had been. What went right?
Well, what went right is Cover California readjusted. They understood that their message was not on point. They were able to bring in individuals. They did marketing, more targeted marketing. They worked in collaboration with the legislature, the Latino caucus. We made sure we outreach in the specific communities that had the highest incidence of Latinos, did fairs, we did, you know, Cover California meetings in collaboration. We did all the signups together to get the message out, and the population increased significantly. And what you're going to see is we need to get ready for the next enrollment period to make sure that it continues to move forward.
When we come back, sir, I want to speak with you about the Medicaid expansion. Some surprises with regard to the expansion. For our viewers on HLN, we thank you so much for joining us. For our other viewers, we'll be right back with Senator Ed Hernandez. Sir, I want to speak with you about the Medicaid expansion. As we know, part of the big selling point was that the federal government would cover the cost of new enrollees in Medicaid if the states accepted the expansion. But that's not the whole story, really. Could you explain?
Yeah, that's partly true.
Right.
Keep in mind that Medicaid or Medi-Cal in California has always been covered 50-50 up to 100% of the poverty level.
Right.
The Medicaid expansion is from 100 to 138% of poverty level, so all of those new enrollees will be covered 100% by the federal government. we are still going to be paying 50% of everyone else.
And what happened was, because there was so much advertising and push to get people to sign up through Covered California, you had folks under the 100% level that it's not covered 100%, as you said, and those numbers are well over 1 million folks.
Right. So what happened is, we always knew that there was individuals out there in this state that were eligible for Medi-Cal, where we paid 50%, but never enrolled.
Right.
So we did such a good job educating the consumers. Sure. They got on the phone, they signed up, and oh, by the way, you're eligible for Medi-Cal, but it's the part we have to cover.
Were you aware of that distinction?
Yes.
You knew that was coming.
It's always been there, because the Medicaid expansion was very clear from above 100% of poverty level. It was in statute,
sure.
It was in the legislation.
But did you expect that California would have to adjust its budget, for example, at the May revise, because over 1 million people signed up, causing a budget hit of over $1 billion?
We knew there was individuals out there. We knew it was a large number.
Right.
But these numbers just blew away our expectations.
It's a blessing.
It's a good thing, because that means more people are covered. So, but I also think that this initial money we're going to have to pay out is going to level out, because I don't think there's that many more individuals out there that are going to come into the system. So this is something that's going to be ongoing from this point on.
We know that other states have not signed up for the Medicaid expansion. It's about half-half at this point. I'm wondering if news like we just described could cause a disincentive for these other states. That California all of a sudden didn't realize, I mean, they knew all along, but it was such a great expansion that they have a hit to their budget.
It could be, but keep in mind that because of the Supreme ruling, that states could opt out of it. So I think the states that did are the ones who obviously don't want the Affordable Care Act to be successful. But if you take Louisiana, for example, if they did the Medicaid expansion, which is covered by the federal government, it's close to 70 to 80% of their population is going to be covered. That's a lot of money left on the table by that state. And that's exactly why Kentucky did it. It's a Republican state. The governor said, this is money that's going to help reduce costs for health care, more money coming into the state, more doctors are going to get paid, but more important, his constituents will be covered and they'll have a healthier state.
I want to ask you about Kentucky and use it as an example for what we're seeing with regard to the Affordable Care Act. I read a poll recently, and Kentuckians were asked, do you support the Affordable Care Act? No.
Right.
Do you support Kentucky Care? Yes. It's the same thing.
That's the same thing, yes.
What is it about the optics of this, that in a state that the Affordable Care Act is so successful, just changing the name?
Well, what it is anything to do with health care since its inception from the Johnson administration, it's always been controversial, and it's always been politicized. So they politicized Obamacare, but in Kentucky, it's Affordable Care Act, Obamacare. The Republicans were opposed to it, but yet they passed it in Massachusetts, which was Romney's blueprint. That's what we have.
We also see in the polling that senior citizens tend to have more negative views of the Affordable Care Act. Yet if you ask them, do you support Medicare? They will say yes. Medicare is a government program, but they're opposed to the Affordable Care Act because it's a government program. Same problem?
Same problem. And I think it's just the messaging, what's in the media, what the public's perception is. And I would think that they're opposed to it because they already have a service. But it's a public program.
At the same time, the numbers are turning on the Affordable Care Act, and they're turning to the advantage of the Democrats and the president. Do you think they turn strongly enough so that November is not as much of a difficult election for the Democrats as some think it could be?
I don't know if it'll turn in time. My goal is that it turns enough that we maintain the Affordable Care Act forever. But I'll give you an example. When Medicare was signed into law during the Johnson administration, it was the American Medical Association that their House of Delegates voted to not accept Medicare because they didn't want socialized medicine.
Oh my. His name is Ed Hernandez, member of the California State Senate. I'm Brad Pomerance. It's California Edition. It's California Edition. I'm Brad Pomerance. We are in Sacramento, the state's capital. We are joined by Sebastian Ridley Thomas. He is a member of the California State Assembly. And so I want to speak with you about the fiscal order of this great state, which actually is not in bad shape.
Not in bad shape for the first time in a long time. It's a constant refrain that you will hear from me, because this is a much better time than what we found ourselves previously. The governor recently released the May revision.
Right.
Revenues are above what was projected. Some of our taxes are a little lower in collections, property tax in particular. So growth was not as robust as we had hoped.
Do we know why property taxes are down?
I think that the housing market is still stabilizing, particularly in the areas that were hottest during the previous housing build-up, the Central Valley, the Inland Empire, and new starts are nowhere near where they were. We have yet to recover. It was anticipated that when we had the downturn in 06, 7, and 8, that it would take until 2015 to reach the same level of growth. We are yet there, so we'll know in a year.
So here's the question. We have more money than we anticipated. We are in surplus. What do we do with the surplus? Do we cut taxes? Do we put it in a rainy day fund? Do we restore money that was taken during the downturn?
I think that it's a combination of a number of things. One is that we must show the voters that we understand what fiscal discipline means, and the temporary tax extinction that we have via Prop 30 on sales and income above $250,000. That will sunset in 2017.
That's soon.
Very soon. So the governor has really been wise, as of legislative leaders Tony Atkins and Darrell Steinberg, in helping us craft a responsible agenda that pays down deferrals to education, pays down debt owed to local government. That's the wall of debt the governor references. And looks toward what strategic investments we can make, particularly in early childhood education.
Although you talk about early childhood education, as you know, the prior speaker, John Perez, Darrell Steinberg, had proposed a program known as traditional kindergarten. It was a big part of their initiative this year. We don't see the governor pushing for it.
Well, the governor, rightfully so, is very focused on how we deal with the current and future budget years in a responsible way that is strategic with respect to its investments, those investments that get the biggest bang for our buck. We know, those who engage in public budgeting, that the investment in human and physical infrastructure are the biggest bangs that you get. So education is the human infrastructure largely. Physical infrastructure, roads, bridges, transportation infrastructure, infrastructure for industrial activity. California is a huge oil and gas state. We're a huge state that does, at one time we did a lot of new starts in development. It's not as robust as it was, though we are adding construction jobs.
Starting?
Year over year, we've added several thousand construction jobs, and we're growing month to month. So that's a positive sign. A lot of that is driven by public works and public-private partnerships. So those are the things that the governor has talked about, but it's really getting early childhood to be understood in that context. And it's not just transitional kindergarten or universal preschool, but it's things like the infrastructure of that system. What are the provider rates for an early childhood or a state's preschool? Because early childhood, you got child care and you got preschool. We want to eventually get to a system that is harmonized, that covers the child care concerns of Californians, particularly the neediest Californians, but also invites a conversation about high-level curriculum and keeping providers in the system.
When we come back, I want to talk more about it. For our viewers on HLN, thanks for joining us. For our other viewers, we'll be right back. So let's talk about this whole notion of paying down debt, because you discussed that, you mentioned that, and we know that the leaders in the Assembly and the Senate have come to an agreement on what we know as a rainy day fund. And part of the discussion in terms of the surplus is to put some money toward a rainy day fund. So it sits there. It's not spent to restore prior cuts. It's not spent to decrease taxes.
It's there for economic distress and to pay down ongoing liabilities, some of which can qualify under our unfunded liabilities, retirement in particular.
So the question becomes, is that the best way to spend the surplus? You know as well as anyone.
It's a temporary, so the surplus is a is not an ongoing pot of money. It is, and it will not be as large as time goes on, unless growth continues and we extend the levels of taxation that we currently have. It represents the increased taxes are $6.5 billion. That's the structural deficit. Obligations to collections, that's the structural deficit right there, $6.5 billion. So when that expires, we will have a $6 billion problem. Half of it always comes from education, because Prop 98 is 42 cents every dollar out of the general funds go straight there. The good thing about a rainy day fund is it will start capturing the revenues, particularly the spiking revenues, which are capital gains. That will be and that's income tax. And that will be all capital gains levels above 8.5%, I think it's the excise tax, up to 10 or 12%.
But the question becomes, since we do see this,
and that's from stock dividends and bonuses, by the way.
Right. We do see that Prop 30 would expire unless extended. That's another conversation. But it really begs the question about how we tax and how we charge sales tax.
Correct.
You know, should we be looking at changing the way we charge sales tax, for example, spread it out?
Certainly, the Parsky Commission on Revenue and the Economy that was sanctioned in 2008 came up with several suggestions. It may be good to revisit and work with stakeholders. But you see, I mean, just yesterday there was an historic announcement on Prop 13 closing a loophole that has stakeholders across the spectrum embracing concepts of tax reform, led by Raul Bocanegra from Los Angeles and Tom Amiano from San Francisco.
And what that will do, I mean, and the poster child for it was right near your district, the Fairmont
Hotel. That's right in Santa Monica.
And I think it's important the viewers understand the way the sale was structured. Majority interest didn't transfer, and so therefore there wasn't an increase in the basis, and so the new owners are able to take advantage of the Prop 13 level.
And the reason you can change it without going back to the ballot is because it was not in Prop 13 in 1978. This was simply the legislature responding to the impact of Prop 13.
It's a clarification.
That's exactly right. Interpreting, I think this was in the early 70s or the early 80s when this particular loophole was created. So this goes back to your question about what tax reform can mean. I think that there's a sense across the board that we have to focus on growth, healthy private sector growth, that we have to make sure that government roles are stabilized, that is, government employment roles and revenues, but that means that you have to have a stable economy and prepare for the hard times, the dips that would be addressed by a rainy day fund.
But you know that because of the way we tax, relying on capital gains spikes, relying on the highest income earners, that we are subject to these roller coaster rides.
The rainy day fund is a step in the right direction, and for 15 years, half of that which comes into the rainy day fund can be used to pay off debt and will aid rather significantly in our efforts to reduce the volatility of revenues, particularly our dependence on volatile revenues.
But the Republicans were pretty firm that accessing the rainy day fund should not be as easy as the governor wanted, for example. So will the funds be accessible if needed?
Yes, certainly they will, and it was at the request of Republicans that we did, I think it's the 50% for debt over 15 years to ensure that that was accounted for. But this is truly a great bipartisan solution, and it shows the stakeholders, again, across the spectrum. I think there are 8 co-authors in each house of each party. And the governor is the sponsor of the bill.
What do you think the voters will say?
I think that the voters will appreciate, particularly if we can show that we are about investing in California, making smart investments, that they are confident that we're spending their dollars well.
His name is Sebastian Ridley Thomas. He is my assembly member, and we are coming to you from Sacramento, California on California Edition.